testament to how much people really care about the healthcare system in Prince George's County and this action coalition. I think the key word is action, that this coalition has really taken a lot of action in this, especially in this past year. I'm proud to serve as co-chair, and I'm honored to try to do my best to be the Pat Sajak or Alex Trebek of tonight's event, to be the moderator. We have a very distinguished panel that's going to be making remarks tonight, and I'm going to introduce them. First and foremost.
Oops. Paul, you went out. You pushed the button. We can't hear you.
Can you hear me now?
Yes. Okay,
sorry about that. Is Sonia Backus, who's the Chief Executive Officer for Greater Baden Medical Services. Greater Baden is a federally qualified health center that provides primary and preventive care services for both insured and uninsured residents of Prince George's County. And Ms. Backus has led an initiative to promote COVID-19 vaccination acceptance among the center staff with at Greater Baden, and does a wonderful job there. We also have Samir Belisle, who is a pharmacist and the manager of the clinical programs from the pharmacy with Giant Foods. The COVID vaccine initiative that's being partnered with Giant Foods is a wonderful partnership, and his efforts in Maryland are focused in areas hit hardest by the pandemic, and we're very fortunate to have Samir join us this evening. We also have Cynthia Bauer, who is the director of the Horowitz Center for Health Literacy at the University of Maryland School of Public Health. And Cynthia is a professor of behavioral and community health and health director for the Center for Health Literacy at the University of Maryland School of Public Health. And the center researches and shares best practices on how to help people find, understand, and use health information. Mike Brown is a barber and member of Health Advocates in Reach and Research, the acronym HARE. Mr. Brown is a barber and community health advocate in Prince George's County, and he has been instrumental in sharing health information and listening to and elevating community concerns about the COVID-19 vaccines. We also have Rakhi Palakar, who is the principal in public health and epidemiology for MITRE Corporation. She is a board certified family medicine physician and was a medical epidemiologist with the CDC, the World Health Organization, and the Maryland State Department prior to coming to MITRE. We also have Katrina Randolph, who is a stylist, and with Trey Shade Hair Studio and member of the Health Advocates in Reach and Research, the Hair Network also. And Katrina has been at the forefront of creating an infrastructure to engage barbershops and beauty salons in Prince George's County as culturally relevant portals for health education and delivery of public health and medical services. And last but not least is my friend and cohort, Ms. Donna Perkins, who will be representing the Health Department of Prince George's County this evening. So with that, we will kick this off, and I will ask, first question is to Donna. And Donna, would you please give everyone an overview of the vaccine distribution efforts for Prince George's County?
And we are recording this. There is going to be excellent information shared, so we are recording this for others who are not able to join.
Very good. Hi, good evening, everyone. First of all, I have to say on behalf of Dr. Carter, our health officer, he loves this meeting and he loves helping to chair this meeting, but he is taking a much needed vacation after a solid year of working nonstop on our COVID response. So I know he is very sad to miss tonight, so I'm afraid you're going to have to make do with me. But we have some great news to share about vaccine distribution in the county. Tomorrow, we will have reached 100,000 Prince George's County residents who have been vaccinated with at least one dose of vaccine. And that is a major milestone after maybe a bit of a slower start than we would have liked. So we are super excited that I can tell you all the news before everyone else knows the news, that we're going to hit 100,000 residents tomorrow. We've seen a drastic increase in the number and percent of seniors that have been vaccinated. So just a reminder right now, we're in Phase 1A and 1B, which are full tilt, and that includes our healthcare providers, our educators, among some other groups, but it's really also inclusive of seniors. For 1B, it's seniors 75 and older. And then we also are currently at the health department vaccinating seniors ages 65 to 74, which is the first part of that 1C group and is prioritized according to both the state and the county. And so with that, we are really close to hitting about half of our residents age 75 and older who have been vaccinated. We're just under that at the moment. And we're about to hit about a third of our seniors ages 65 to 74 who have been vaccinated. So again, very good news there about the progress that's been made over the last few weeks to get vaccinations going. And we have some great partnerships with our both with the local hospital systems who have helped to move folks off of our pre-registration list and into vaccination spots as they've become available through their facilities. And we've also been utilizing the state's Six Flags site to help make sure that the folks on our pre-registration list are able to get vaccinated as quickly as possible. And right now, just for a background, our pre-registration list is up to about 172,000 people. That's across all phases. And that does include folks who maybe work here in Prince George's County but don't live here. Of that group, the actual residents is over 150,000 at this point. So we've got a pretty robust response going on with our pre-registration, but there is room for more.
Well, great. Thank you, Donna. That's wonderful news. And I think that goes to why most folks, or the overwhelming response of how people are feeling is hopeful. I mean, people should feel hopeful based on that really wonderful update as to how we're making progress here. And so thank you for sharing that. It's really great to hear. Kind of continuing that vein, I'd like to ask Samir Bilal, with Giant, talk to us about how Giant is working within the county to help with this vaccine distribution, and specifically how you're reaching out to our vulnerable senior population.
Yeah, so we've been very fortunate enough to have an excellent relationship with the Maryland Department of Health, and they've been able to marry us with facilities specifically in Prince George's County as well as all over the state. So we've had some really good conversations, and we've been able to address a lot of the communities in Prince George's County, specifically the assisted living facilities, as well as the 65 plus community. And I think it's been a great relationship so far in that if people don't necessarily have the access to the online portals, registration access, that we are able to go offsite to them and come to their facilities and address their first dose and then come back again in 28 days. We've done several of the assisted living facilities already. One of the bigger wins that we've had was the Prince George's County, the ARC, with Rob Malone's team. And we've been there. We were about to finish off our last clinic this week, but we've gone back about 5 times. We've done about 300 people a day. So it's been really great that we've been able to address that community that is more times often than not forgotten. And we plan to go back again in 28 days to make sure our patients finish their series. And that would not be just for the patients, the DD community, but also their caregivers as well, right? So so far it's been great working with Prince George's County Department of Health, and it's been a great marriage so far.
Great, thank you. And Giant is such a valued asset in the community and has such a Prince George's County centric focus. So we appreciate your efforts. Any concerns on your part?
I mean, my biggest concern is going to be vaccine supply, of course. We're ready to go. Our job is to put shots in arms and address the needs of the community, specifically those communities that have been most negatively impacted by the pandemic. But of course, the rate limiting factor is going to be supply. So again, being able to work with community partners, educators in Prince George's County, as well as the Prince George's County Department of Health to identify the locations and communities that are most in need has been imperative. And it's, like I said, we're ready to go as long as we have enough vaccine. But that's kind of where we're at. So hopefully, with new products coming in the line, single dose Johnson & Johnson coming up, and as the vaccine supply ramps up, we'll be able to service more members of your community.
Great, terrific. Thank you for that. Our next panelist that we'll be hearing from is Mr. Jimmy DeWitt, who is a patient at Greater Baden. And I'm very, appreciative of Mr. DeWitt that you've agreed to join us and share your thoughts tonight. And specifically talk to us about how you see the attitude of folks, how it's changed or evolved between when the vaccine first came out and now, and how people are responding to actually get their vaccination. Can you share your thoughts about that, please? Mr. DeWitt?
Can you hear me?
Yes, sir. How are you?
Pretty good. I'm kind of shocked at the fact that you would think that most of the older community would be the ones who would be rejecting the shot or the concept of it. But it seems like a lot of younger people are the ones that really doesn't want to get involved. So I think of some sort of a campaign to reach out to them and inform them or educate them on the facts pertaining to what the vaccine is and what it would stand for and what it means for the society itself as being a safe and healthy community.
Great. I couldn't agree more. And I think that's a great segue into the CEO of your health facility at Greater Baden, Sonia Backus. Sonia, good evening. And can you talk to us about how we can address the very issue that Mr. DeWitt brings up?
Absolutely. I'd love to share with you all the campaign that Greater Baden did. First of all, thank you all for having us participate. I'm appreciative of Greater Baden having the opportunity to share tonight. And we decided in our organization that we wanted to take a two-pronged approach to encouraging and supporting our staff in their choice to get the vaccine or not. We had lots of conversation internally about whether we would push to make it mandatory as we do with the flu vaccine. But because it's under emergency use, we decided that we would not require it and have been very supportive of even those team members who made a decision not to get the vaccine yet. And I say yet because I know that, over time, they will likely come along. But what we did was our Chief Medical Officer, Dr. Anish Patel, is so creative and amazing. He came up with this campaign called the Mythbusters campaign. And so he went and just looked for ways to make it fun for our team members. And he put out all of these crazy Mythbusters. But the interesting thing is the one that I loved the most was the myth was, I hear there's a chance I can go into anaphylactic shock after getting the vaccine. And the chances of getting an anaphylactic reaction by a COVID vaccine is about 1 in 355,000 people. And the chance of getting struck by lightning is 1 in 180,000 some odd people. So you're about twice as likely to get struck by lightning as you are to have a reaction from the vaccine. So that's the kind of Mythbusters he put out and gave every single employee of ours. We have about 150 employees, and he gave every one of them his personal cell phone number and his, of course they have his email, and said, reach out to me anytime if you or even anyone in your family has questions. And so we had his expertise from the science background. And I am a leader who I call it leading with love. And I layer love into everything that we do at Greater Baden, including accountability. And so I thought that I would take the approach. The second prong of that approach was the love approach. And so I recorded a video. And I probably should have had my family members sign a release, but I didn't. But I recorded a video for our organization, and I talked to them about the real reasons that I was getting the vaccine, because honestly, I was a little nervous as well. And so what we did was I recorded a video, and I talked about my 83-year-old father, who I love with every ounce of my heart, and my 9-year-old grandson, and my sons who are 28 and 31, and my sister who is my best friend in the world, and how I wanted to be able to be with them and be around them and other people in my family. And last but not least, of course, my Greater Baden family. If I'm strong and healthy, then I can lead Greater Baden to be strong and healthy. And I have to be, I have to be physically healthy to do that. And so we tied in the science and the love. And when we initially started, kind of polling our team members, we were running about 45% of team members who were saying that they, would possibly get the vaccine when we got it in. And we ended up right at about 60%. And that number continues to increase every week. We have a team member say, well, I think I'm ready to get it now. And so we get them right into rotation with the patients. But it's certainly been, it's a journey, and we have to support those who have made a decision not to get it yet, but also really, really open the door through the scientific information and, getting people to think about, who they want to protect when they get the vaccine.
Well, that's terrific, Sonia. Thank you so much for sharing that. And I love what Greater Baden has done, is doing, and will continue to do. And we benefit greatly from your leadership there. And those were some really good stories that you share with us that I think will help a lot of folks get a better understanding of exactly what we all need to be doing and how we need to lead in this. So thank you for sharing that. It's terrific. Our next panelist is Katrina Randolph, who is with the stylist and community health worker. And so here we have boots on the ground, if you will. Like, you're out in the community, you're talking with citizens in Prince George's County on a daily basis. And this is a topic of conversation when folks go to their barbershop or their beauty salon. I'm sure that's dominates the conversation. So what are your customers and colleagues saying about the COVID-19 vaccine? And what would you like to share with us that you've been hearing to date?
Named Barack Obama knew exactly how then President Bush.
I think Katrina may have had some trouble joining, but can we pitch that to Mike Brown, who's also in the Hair Network?
Hello, I'm Mike Brown. Yes, to answer that question for Katrina, I feel I speak on both our behalves. We have a multiple level of people who come into the barbershops and salon. We cut judges, doctors, lawyers, street guys, thieves, hustlers, every level, walk of life. And what we all share in common is how we feel about the vaccine. And a lot of people have been apprehensive, but through the information that we've been getting from Dr. T, we've been feeding it to the community when they come into the barbershop. And you have so many different types of sayings that they think the vaccine will do. Is they're trying to put the chip in you. They're trying to stop the Black man from repopulating. It's so many different things that they say. So I've come up with one question for them when we get into this conversation. I asked them, if the vaccine is plan A to stop the spread of the coronavirus, what is your plan B if you're not going to take the shot? And they're silent. They don't have anything to say. They go on to, well, Tuskegee. And it's that, well, Tuskegee, let's shine a little light on Tuskegee. Tuskegee, I'm not telling you to disarm yourself. What I'm telling you to do is take a position to want to protect your loved ones and yourself. You have to believe some of this data is real as far as the numbers that the people are dying. And we have to take a position to try to stop the spread of this coronavirus. And the vaccine seems to be the way. And we just try to preach that into the community with their questions and their questions that, I mean, their answers, they really have no validity to them. So we try to just eliminate the questions that have no validity and stick to the scientifically speaking facts. And that's how we've been getting the message across throughout the barbershop. I think you're on mute.
Yeah, it keeps automatically doing. I'm sorry about that. Have you found that as you are sharing that information and that people are responding and coming back to you and
No
responding positive? Good. Okay.
Without a shadow of a doubt, they at first they were saying hell no, pardon my French, but now they're saying
Yeah.
I'm just not going to be the first one. I'm going to do it for my grandma now. So it's starting to melt. The ice is melting, and I feel like we had a big part in doing that.
And there's no doubt that you have, and I think it's terrific. And I mean, I know even the barbershop that I go to in Prince George's County, and it's a lot of a collection of 6 older generation Italians that they're over in Lanham Severn, and but that's the topic of conversation amongst all the patrons in there, and people coming and going all the time. So I mean, the work that you're doing is important and very much appreciated by those of us in the healthcare field. So I really thank you for sharing that and educating yourself to help educate your customers. And thanks for doing that.
Thank you.
Terrific. We'll now move to Dr. Palakar. And the question, doctor, is, can you talk about the variants of the COVID virus? And because there's a lot of misconception or lack of understanding, this one from Brazil, that one from the UK. I mean, there's people are talking about these different variants, and just kind of give us an overview on what folks should be focusing on and what they need to know.
Yeah, absolutely. And thanks. This is such an important topic, and thanks for the opportunity to be here with all of you. Such a great conversation so far. So I think it's important just to, take a couple steps back and just remind ourselves a couple things about COVID that will help us understand the conversation about variants. So we've been hearing obviously about COVID and the virus that causes COVID. And it's important to know that really all viruses change over time. Some viruses change more than others. And so folks will be familiar, for example, with flu, and flu viruses change very quickly. And that's why we are encouraged to get a flu shot, for example, every year. And just like flu viruses, the virus that causes COVID-19 has also been changing over time, and has been changing since it was first detected in China last year. And these slightly changed viruses we call variant viruses. And so, I think the bottom line is just to say first that it's not unusual that we're detecting these variant viruses. Now, of course, variant viruses make the news, and we pay a lot more attention to them from a public health and clinical standpoint when they do something that's slightly different. And so that's the reason we've been hearing and talking a lot about the variant viruses more recently. And so we certainly have been hearing a lot of alphabet soup, I think, about the different variant viruses that have been circulating. And if we just look to CDC, for example, the Centers for Disease Control and Prevention, they really pull together that national view in terms of what's happening across the United States in terms of these variant viruses. And if we look at what CDC is saying right now, the primary variant virus that we're seeing right now is one that's called B117. And this virus has also been referred to as the UK virus. And so folks might have heard it called that as well. But I maybe want to take a step back from that and just remind folks or maybe draw attention to the fact that in 2015, the World Health Organization actually suggested and recommended that we avoid using geographic names, cities, countries to name viruses because of the fear and stigma that it can create. So, while it's talked about in the media sometimes as a UK virus or a South African virus or a Brazil virus, we really want to try to stick to calling it by its more virus-like name. And so that's the reason, we're using words like B117, even that's a little bit harder to remember. So in terms of this particular virus, from what we can tell so far, it does look like this B117 virus is slightly more transmissible or shared from person to person, which is the reason that we're paying more attention to it. In terms of how severe the illness is that it causes, we really don't have a lot of great data on that piece yet. So it looks like the severity is largely similar to what we've been seeing, but there are potentially some other emerging studies that have suggested that there might be increased severe illness associated with this particular variant. In terms of the vaccine question related to this specific variant, so there are 3 vaccines that have emergency use authorization right now. the Pfizer and the Moderna vaccine. So studies done by Pfizer and Moderna, they've tested against this variant virus and found that it's indeed effective against these viruses. And we think it's likely the same for the Johnson & Johnson vaccine that was just released and is rolling out this week. There are two other variant viruses that I just wanted to mention that folks might have heard about recently. There's also one called B1351, and this virus was first detected in South Africa. And then another one called P1, which was first detected in Brazil. And we do have evidence that there are cases of both of those variant viruses circulating in the United States, but those are not the ones that are really predominating right now in terms of variant circulation. And these viruses in particular, these variant viruses might be slightly more problematic in terms of the vaccine. We're seeing potentially some reduced efficacy of the vaccine against these particular viruses for the Pfizer and Moderna vaccines, but likely the Johnson & Johnson vaccine we think is going to do similarly well against these two variants.
Great. Well, thank you for sharing all that. It's a great education for all of us, and it helps to dispel some myths, if you will, or some misconceptions, and we appreciate the input. Last but not least, question for Dr. Cynthia Bauer. And Dr. Bauer, you've heard from all of the panelists, and this kind of gives you an opportunity to sum up. So what should the messaging for everyone be based on all the input from our various panelists from their various perspectives? What do you think the messaging should be? Because all of us that are part of this action coalition have opportunity to share information with different folks out in the community. How would you encourage us to share that information, and what do you specifically think that messaging should be?
Well, thank you. Good to see you all tonight. So I think you heard from a couple of people that, you know, even though from a public health perspective, we might not feel super comfortable with this notion that the vaccine is a choice, right? As public health people, we're like, okay, the vaccine's sort of the obvious answer. But I think you've heard from some of the comments tonight that in this particular case, recognizing the fact that this is a situation of choice, right? Right now it is not a requirement. And so we have to get comfortable with the notion, I think that Mike Brown was alluding to, that people have to have enough information to feel comfortable with their choice. So I think that's a really important thing to remember. And as a health communicator, I think one of the really interesting things to remember is normally if we were to ask people about, you know, a treatment or a decision about healthcare, they'd say they want it to come from their personal physician. But we're not in a situation where that's possible right now. And so I think you heard from Mike and some others about how important that personal example is, and their hearing from their peers. So I think, you know, if, you know, our theories and our models tell us that we should be very active in disseminating information, but I think right now the situation tells us we have to like double, triple, quadruple down on just pushing out as much information as we can in the ways that have been suggested about really listening carefully to people's questions, giving them information in a way that makes sense to them. It is challenging because there's so much jargon associated with COVID-19. You know, we saw it back a year ago when everyone was running around yelling about flattening the curve, and really nobody really knew much about what a flattening the curve really was. So I think, you know, to the best of our ability, being sensitive to the balance between being scientifically accurate, but that everyday language that you heard is so important in terms of helping people feel comfortable, because that is really where we're at, is that people have to get to that place, of comfort before they're willing to make this move. And I think this is very different from a lot of other public health situations that we've had. So, but I think you've heard from people working on the ground that's the reality of that's changing minds right now.
Very well said, Dr. Bauer. Thank you so much for sharing that. I understand we do have Katrina Katrina Randolph has joined us. And Katrina, we heard from your colleague, Michael, about what kind of information he was sharing with his customers out there in the community. Could you give us your insight as to the kind of conversations that took place in the community in your salon?
Sure. When the vaccination first came about, I was really honestly hearing a lot of no's from a lot of my clients. And I service about 50 clients a week between the ages of 21 and 70 years old. So as the clients got a little more educated and did a little more research, as I encouraged them to do so, then their mindset started changing. So we went from about 50% of the clients saying no to now about 75% of the clients saying definitely, I'm going to get the shot. And a lot of them, I was telling them, just do your research, do your homework, because there's a lot of things out there on social media where people is against the vaccination. So a lot of people going on hearsay instead of getting this informative information. So what I was doing for my clients is pretty much sharing information with them, finding sites for places for them to go to be vaccinated. So a lot of them are more confident, especially my older clients and the clients that have, underlying health conditions. So they're feeling a little more confident because I believe that they even trust in the relationship that they have with me. If I'm saying I'm going to get vaccinated now, they believe that, okay, if Katrina's going to do it, why not do a little more research and try to be a little more confident in getting this vaccination?
Well, thank you. And thank you for taking the lead on that, because that's the kind of effort that we need. People just like they trust their healthcare providers. They trust their personal, their stylists, their barbers. And, for you to take that stance, educate yourself so that you can help educate your customers is just a terrific thing. And I appreciate you sharing that with all of us tonight. So thanks so much.
You're welcome.
Mr. DeWitt, I understand that you've been very vocal in sharing with your friends and colleagues the importance of getting a vaccine. Could you speak to that as to, what's driving you to take that stance and be more outspoken about it? Mr. DeWitt?
I'm
here. Did you hear my question, Mr. DeWitt? I think you're on mute, sir.
Can you hear me?
Yes, sir.
Okay. I heard your question.
Great.
I have a relative. He's a cousin. We were raised like brothers. His mother and my mother were younger sisters. And he was working with a food bank. Went up to the northeastern area, the New England area, to distribute food, he and his wife. He caught the virus. Both of them were hospitalized. She made it home and he didn't. So for 2 months, my brother laid in the hospital up there and died lonely by himself. So prior to that, paying any attention to any information pertaining to the COVID was like, it's unreal because it never affected me. But once it affected me, I saw how serious it was. And the reason why I'm really trying to participate and gather this information, because the more information that I can gather and get from the professionals such as yourself, I can arm me so that I can go to the community and the people that I'm involved with and that I love and express it to them, in a way it should be given. See, I'm a special police officer. I consider my Metropolitan Police Department. I consider myself a peace officer. So I communicate with a lot of people on a daily basis. And I would really I'm gathering this information down, I'm jotting notes and keeping notes so that I can come to someone with the correct information. And that should help. And that's why I think this was so, I really wanted to get involved with this. And especially speaking with the professionals at Greater Baden, they gave me an opportunity to share this and get this out. So I'm just grateful. Thank you.
Well, thank you for sharing that. My condolences for your loss. I mean, there's so many people, we all have been affected by this. I don't know a person in my world that hasn't, had a tragedy as a result of a loved one or a friend contracting COVID and passing from it. So I appreciate you sharing that with us, and my condolences go to you and your family for your loss. And in helping, the idea of helping to get the right information to folks, there's I'll pose this question to the physicians on our panel. There's a lot of questions from folks saying, well, if I already tested positive for COVID and I successfully was treated for it, and and now with subsequent follow-up tests, I'm testing negative, when would I be eligible to receive a vaccine, or should I have a vaccine since I haven't? We need to clarify that misconception. So Dr. Bauer or Dr. Palakar, either of you care to address that?
I'll defer to Dr. Palakar on that.
Yeah, I'm happy to answer that one, Paul. So that's a great question. And we're recommending that even folks that have had lab confirmed COVID or clinically confirmed COVID still be vaccinated. And really, you can come in for a vaccine as soon as your county health department tells you that you're eligible, provided you're no longer in that period where you need to be in isolation. So talk to your county health department to get the best information about when is your sort of spot in line, when is your turn, and then go ahead and get vaccinated.
Great, thank you. And a little follow up to that, if you wouldn't mind expanding. So, and again, it gets into the detail, but these are the types of questions that people are asking. So a person had their first vaccination, and the time in between the vaccination, they test positive for the virus. What should they do?
Right. So if we're thinking about, for example, one of the 2-dose vaccines, so the Moderna or the Pfizer, folks will know that there's this period of 21 or 28 days that you have to wait in between getting the first and second dose. And so the way that those vaccines were studied to figure out when they were the most effective or provided the most benefit to folks, it was really 2 weeks after that second booster. And so unfortunately, that means that after that first dose of vaccine, you really don't have that full protection quite yet. And so that's why it is possible to contract COVID during that period after the first dose and before you've had the second dose, and sort of build your full immunity 2 weeks later. And so after you've been out of your isolation period from when you've been diagnosed with COVID would be when you'd want to go ahead and get your booster or your second dose, provided that either 21 or 28 days have passed, depending on whether you received the Pfizer or the Moderna vaccine.
Okay. Thank you. Thanks for that clarification. Sure. Allison or Edelyn, I've been trying to stay focused on my role as moderator, so I haven't been able to see the different questions that are coming in. Is there anything that's come in that you've seen that you would like to share with the group and access our panel to get some clarification on?
Okay, so Paul, I've been taking down the questions, so I'm more than happy to share them.
Thank you.
So there were 3 questions so far, but by all means, if you have any other questions, please feel free to put them in the chat and I'll make sure to share them also. The first question is about Walgreens. So I'm going to share this question. It says, it appears that Walgreens is allowing people under 65 who are obese to get vaccinated. It doesn't seem right when some vulnerable elderly people still need appointments. So that was a comment / question, I guess, if anyone can answer why that is happening.
Panel? No one wants to touch that one. No, I'm kidding.
I mean, I can at least take it and say, sure, right. So the state of Maryland has specified that all of phase 1 is eligible to be vaccinated. So the providers in the state of Maryland are able to vaccinate folks all the way through 1C. However, the health department here in Prince George's County is only vaccinating seniors ages 65 to 74 from that 1C prioritization group. Because we did believe the evidence shows us that seniors are definitely more predisposed to having poor outcomes from COVID, and we felt like that was a priority that really needed additional focus in this county before we were able to open it up to other folks of course, all of this is driven by we don't have enough vaccine for everybody yet. If we had plenty of vaccine, that would be great, and we could get those appointments filled and get more folks in. But with the limited supply, when you're thinking about who is going to, when you're looking at who would benefit the most from the vaccine, the evidence was pretty clear that we needed to focus on those seniors. So that is why the health department has not opened up at least the health department sites to folks in 1C beyond the seniors 65 to 74. And we continue to focus on our seniors 75 plus.
Well, and thank you, Donna. Let's stay there for a second. So, all these things take trial and error. You get a rhythm. You start to figure out how things work. You have your shakedown crews, whatever term you want to use as when we introduce a new process, especially in healthcare. So I was very pleased to hear the number. So it's basically 10% of the population of Prince George's County that we know of have been successfully vaccinated. So it's going to be an exponential rise. What are you hearing as far as what we would be projecting as the number of folks being vaccinated on a daily basis? So if it went from 1,000 a day at one point to 2,000, what are we saying that ultimately we're going to be able to handle? And based on all the different sites that are going to be made available. And that may not be a fair question to you, but I just get your insight into that. I would have asked Dr. Askew. But
let me do some. So I can tell you that last week we had a new high with over 5,000 vaccinations provided in one day.
Wow. Okay.
So we're already up to a point of 5,000, but again, that's very much limited by the supply, as my colleagues here have expressed. So just knowing what between just some of our bigger partners as well as the health department is capable of doing, you're looking at us being able to truly push out tens of thousands of vaccines per day to our residents with an appropriate supply. So, and we've really worked very diligently to build the capacity. Right now, our capacity has outstripped the vaccine supply because we have more appointments available. For example, at our health department locations, far more available at our health department locations than we have supply of vaccine. So we've made sure that we've pushed very hard to get the capacity built in. So when the vaccine is available, we're ready to go.
And what are you hearing about the supply chain? As far as the availability of vaccine on the rise, as far as production, what are they promising you?
Yeah, I am, I'm not in those conversations, but what I can say is we don't necessarily anticipate that going up at least for the next week or so. So based on what the state has projected because we of course get our vaccine through the state ordering system. So we don't see that happening, for another week or so, but we are continuing to look towards the end of March as being in a much better place with the supply of vaccine.
Great, thank you. Samir, do you want to add to that from Giant's perspective? Is Samir still with us? Okay, well, we'll give him a chance to come back. Sylvette, what other questions do we have to share with everyone?
Sure, now we have a few more. So this next question is about the variants. Do you think that there will be boosters to address the variants over time?
Paul, would you like me to take that?
Please. Thank you.
It's a great question. And while it's, sort of impossible to see into the future, I think the likely answer is yes. Whether this becomes a virus that behaves somewhat like flu viruses, meaning it kind of comes back periodically during our cold weather season, when we all get vaccinated against this particular coronavirus remains to be seen. But I think that's certainly a possibility. And certainly as we look at these variant viruses that are emerging, if the vaccines are not as effective as we'd like them to be, it looks like most of the pharmaceutical companies are going to have a booster that they'll, be able to push out relatively quickly, at least to be able to sort of deal with this immediate issue in the coming potentially 6 months. But, over the long term, it certainly is a possibility that, we get an annual booster for coronavirus, just like we do for flu.
Right. Thank you. Yes, that's the information that we're hearing pretty consistently. So thank you for clarifying that. Sylvette.
All right. And our next question is, with all the variances that have been talked about from other countries, why is this country not stopping travel to get a handle on this virus instead of knowing what is coming and to continue to do business as usual?
That put a big smile on your face, Sylvette.
Shall I take that one?
I thought it was another really great question.
It's a great question. It's a great question. Absolutely. I think while it might seem like a good idea to shut our borders down and try to keep viruses and other pathogens out, we just know in public health that that's really not effective. Really the best strategy is try to get ahead of what's happening and get early signals that viruses are changing by doing genetic surveillance of the viruses and working, across the oceans with our public health colleagues in other countries to better understand what is being seen in those countries as well, and use those partnerships and relationships for all of us to better understand what's happening globally. And so generally speaking, in the public health world and from the World Health Organization standpoint, we don't, recommend closing borders as a way to control the spread of viruses.
Right. Thank you. I got a note that Samir, you're able to rejoin us to make a comment on your perspective on the availability of vaccine, what you're seeing from a supply chain standpoint through your position at Giant.
Yeah, I mean, it's very much like the stock market, I think, is a fair analogy. It is changing and things have gotten better in the past few weeks. But I think to piggyback off what Donna had said, what Maryland Department of Health and Prince George's County has done extremely well was activate these community partnerships. So that way, once supply is ample and we're burning through whatever we're getting. So that looks good, right? When we're talking about federal allocations, we're not wasting. We're, at least for Giant Pharmacy, we're having, I think last week we had over 100% of our burn for our doses, simply because some of the vaccines are yielding 11 doses, 12 doses. So showing and demonstrating that we're really burning through the vaccine as a state, as a county, it really does speak well for us and getting more allocations and confidence that we will burn through the doses. So I think, yes, I just wanted to add that part. So hopefully, yeah, I think the rate limiting factor most definitely is vaccine supply and production.
Great. Thank you, Samir. Appreciate that insight. Sylvette.
Okay, there was another question that said, currently there are extreme barriers in place for people making appointments with the current systems in place. What strategies are in place to address access inequities for minorities and or marginalized populations? And I know that the CE spoke about this last week too, so just put it out there.
Okay, who would like to take that?
I think there's a few of us that could answer that one, to be honest. I can speak at least from the health department perspective. And as Samir said, we definitely are using our partners to help make sure that we're pushing vaccine out to the community. And having those partnerships in place is absolutely critical. So for us, we've also been able to deploy our mobile units. So we have 3 mobile units that have been out and about, and they have included partnerships with local organizations, local trusted organizations, to help address some communities that may not be as predisposed to want to, for example, sign up on pre-registration or have documentation to show that they live in Prince George's County. And also we have been deploying the mobile units to visit, for example, seniors who are homebound. And I hopefully, do we have time? I'll share a very quick story. We actually, our vaccination lead was out yesterday doing a home visit, and was unable to vaccinate a resident, but discovered they had extremely high blood pressure and probably helped to avoid a significant medical event for this individual. So it's going to take us a little while to get through all of these folks, especially our homebound population. So I just want to put that out there because we've been getting that question a lot. But part of that is because our nurses are doing their job and making sure that these folks are able to be vaccinated and in a healthy enough place. And yesterday spent quite a bit of time on the phone with their doctor. Paul, Paul, are you having trouble there? No. We also have a health equity team that is reviewing the data regularly. So I am on call for that one since I'm the data queen at the health department. So for example, we are looking at where residents are being vaccinated, especially our seniors, looking at those vaccination penetration rates in different parts of the county, and planning events around pre-registration and vaccination for areas that maybe are falling a little behind the rest of the county. So that is literally something that I am doing every day at this point. So that's very much a focus, especially for our Office of Community Relations. They're taking part of the lead of being that reach out into the community and helping to facilitate those pre-registration events. So we can get folks on the list and get them in as quickly as possible, or share them with our partners, which is another method that we've used to help reach out into some populations that may have transportation challenges. For example, we're trying to get people as close to a vaccination site as possible, and also when we can, we're bringing it to them. So it's going to be a multi-layered strategy, and it's definitely going to continue to be a big focus of our efforts.
Thank you, Dawn.
May I add a little bit to that from the FQHC perspective?
Please.
Okay, so our FQHCs in Maryland are receiving a small number of vaccines, and all of our patients in general are underserved and in marginalized populations and communities of color. So we are getting some vaccines. The big issue is supply. And so because the supply is still low, we primarily are vaccinating our patients, but again, they are underserved. So we are getting some into the arms of the underserved. But FQHCs are strong and vocal advocates, and we have been ringing every alarm that's possible as individual health centers, and then collectively to both up to the federal level and to the state level, as well as the county. We just had a conversation with Dr. Carter on our weekly, our bi-weekly meeting. So we are advocating for and asking for more vaccines all the time. And what our goal is to be able to vaccinate all of our patients. And if you add all the FQHCs together, you're talking several hundred thousand patients across the state. And in Prince George's County, probably as many as 60,000 or more total patients when you add all of the FQHCs in Prince George's County alone. So we are putting a voice out there for the underserved for sure, and ensuring that as many of them as possible get those vaccines. And we'll do more with the community as we have more vaccines available.
So what percentage of your patients would you say currently have been vaccinated? I mean, either by you or through other sources?
So we have in Prince George's County alone, we have a little over 12,000 patients. So of those 12,000, we've vaccinated only about 700. But the reason, part of that is supply. And then part of that is also that we are focusing within the state's guidelines for the phases. So we're in phase 1C. So we've been focusing on our patients who are 65 and older, and some patients who meet other criteria of the 1C, but they're mostly been 65 and older. And so as phases open up and we receive more, obviously that'll give us much more opportunity.
And so what do you think your potential for receiving more, like, what are you hearing? Like you could get?
It's I would say as of today, it's looking better. Okay. Both the state and federal government have asked us for more information on capacity. and what we plan to do. The other piece of that is going to be the stimulus bill passing, because it's quite evident that there will be dollars for community health centers, which will be extremely helpful in staffing up, because staffing, and space can be a challenge. So we'll be able to staff up in different ways to be able to support more of the mass vaccine clinics and and events as necessary. So we look forward to that. We have focused a lot on getting in those seniors who have not been into the health center for a long time. So we've been able to get them a visit and catch that high blood pressure, catch that A1C that's out of whack, as well as get the vaccine in the patient and get them back for their second vaccine and even a follow-up. So we've been able to have really a dual effect on our patients, which has been phenomenal.
Okay. Thank you, Sonia. Appreciate you sharing that. Sylvette.
Before I go to the next question, there was just a quick comment in the chat that said, yes, utilizing the FQHCs would be an excellent model to get shots in the arms. They are trusted by their patients, and when the FQHCs reaches out, they will answer the call. So thank you for all the work that you do. All right, I think Donna answered one of these questions, which was how are our home seniors getting vaccinated? So thank you, Donna, for answering a question before I gave it to you. There's another question here that says, does the logistics on storing the vaccine, could that be what's driving the pharmacies at Walgreens, Giant, et cetera, vaccinating other eligible folks before seniors?
I guess I'll speak to that. So as far as logistics of the vaccine, so specifically in Maryland, we have the Moderna vaccine, which if you are unaware, once the vial is punctured, you have 6 hours to burn the doses. Generally, the vial can be kept at freezer temperature until its expiration date. However, it can be kept at room temperature once it's open for that 6 hours. So in certain situations, yes, there is kind of a fire drill where we don't want to waste a dose and we're looking for arms. I can speak for my organization. I can't speak for Walgreens. However, for us as an employer, we are immunizing our grocery store employees first, those who've expressed interest in receiving the vaccine. And then, of course, that is to include the pharmacy team, technicians, pharmacists, and then working our way through the rest of the store. And then we're going to look for patients in the store who are 65 and up. So if there's a one-off situation where somebody received the vaccine who's a 30-something-year-old, I think I've been given directives from the Maryland Department of Health as well. We just don't want to waste, because at the end of the day, we want to make sure that everybody gets vaccinated. So I think it's become kind of a situation more recently where we don't want to really put our pharmacists in a position where they're policing the vaccine. We just want to be able to immunize, because that's what we do best. And I think more importantly, in the community pharmacy landscape, and being that we are in a grocery store, when you talk about accessibility, I think it's fair to say that I think 90% of Americans live within 5 miles of a grocery store, or within a community pharmacy rather. So I think providing our constituents one-stop shop, and then allowing them to get their vaccine, as well as address their other prescription needs and do groceries. I think it's a great opportunity to provide that for Prince George's County residents. Yeah, I mean, yes. So there are situations, and I'm sure it's gone around, where somebody who may not necessarily been in a classified population to receive the vaccine, but like I said, I would be devastated if we threw away a dose, and that's one less life protected.
Absolutely, absolutely. Thank you.
Thank you for sharing that. I saw, Sylvette, that David Chernoff from TLC had submitted a question, but it got cut off before I could read it. Did you?
Sure. I'll read his, and then I'll circle back to some more that were above those, but I'll definitely read his. It says, how might other organizations that touch many of the same patients at risk in the county how can they help to help spread the message about vaccine importance?
I think that goes back to Donna as well.
So I think too bad we don't have one of our public information officers on. So we've actually with the county response have had a joint information center ongoing for the last year. First for the cases and COVID emerging, getting people to wear masks. Now, of course, a lot of that messaging has moved over into vaccination. So we definitely have a lot of materials available to help support that messaging. As far as specific partnerships, I think they're always looking for ways to make sure and push that messaging out into the community. So if anyone's interested, we have a vaccination. Well, Allison and the team can speak to the vaccination ad hoc work group that's been occurring through the coalition. And we actually have a representative from our Joint Information Center who is able to help facilitate some of that distribution process. So that might actually be a question for Allison more than me.
Okay, Allison?
Yeah, just a quick plug for our ad hoc vaccine working group where most of the panelists today came from. We put out a call that we wanted to have this community forum. And so we meet every other Monday at 11 a.m. And we just share updates, we share information. If we hear concerns coming from our constituents, our clients, our patients, we elevate those up. We work together, try to find solutions in real time for what's going on. We don't know what the agenda is literally till that day, but we come together and we learn and share and try to problem solve together. So if you're interested in that, I encourage you to email me. I send out a lot of the emails, email any of the research assistants, or drop your name in the chat.
Great, thank you, Allison. Sylvette, I think we have time for one more question because I know we still have some agenda items for the latter part of the meeting. So share with us your best one.
Okay, and we will save the chat, so at least some of those that may not have been answered, we can always send find the answers and send it to those individuals directly. But this one says, I participate in community meetings and I hear people say that they will not take the vaccine because of information that they've seen on YouTube, religious leaders and family members who believe that the vaccine will harm them. What tips can you provide on how to address their concerns in a conversation?
I think our friends in the barbershop, Mike did a great job. So I'd ask them to comment again, and then maybe Dr. Palakar could also comment.
Mm-hmm.
Well, definitely, you get different walks of life from and different opinions and different beliefs on what they feel about the coronavirus and taking the shot. So I reiterate once more, once you get those different diverse questions like they're trying to put a chip in me, they're trying to stop the reproduction of Black men, it's so many, it's going to give me Bell palsy, I'm going to pass out, they're going to kill me. So the question I love to stick with those type of people, I just ask them, you know, if to stop the spread of the coronavirus, the vaccine if the vaccine is the answer to stop the spread of the coronavirus, and that's plan A, what is your plan B if you're not going to take it, scientifically speaking, to stop the spread of this deadly disease in our community? And they can never answer the question. They ramble on about this and they ramble on about that, but the question is never addressed. So that there to me is like a seed planted, because they're going home to think about that.
Right.
And when they come back, their perspective has changed. They're like, well, you know, my grandma, I don't want to get grandma sick. I'm just not going to be the first one, Mike. Tell me some more about it. And that's how we began to break the news and crack the ice, or break the concrete, so we can start penetrating through to get the message through to stop the spread of this coronavirus.
Excellent commentary. Katrina, you want to add to that?
Back off of what Mike said. A lot of times when I'm in the salon with my clients, we like to dialogue about this vaccination. And what I tell them a lot of times is, don't take this misinformed information and decide to make a decision for your life. Stay informed, you know, do your research, do your homework, take what I'm giving you from what I've learned from the Health Advocate and Research Group, and just do your own research. Don't go on what you hear in the media, because a lot of times it's falsified information. Know for yourself. And then, like Mike said, make sure you protect yourself, because if you're not going to take the vaccine, then what is your plan? And then make sure you're protecting not only yourself, your colleagues, and your community, along with your loved ones. You know, you have to make some type of decision, but make the best decision for yourself.
Terrific, thank you.
Paul, can I just add one thing to that?
Yeah, please.
So I think those are all great tips. I think when we're asking people to do their own research, it's really important to emphasize that they need to rely on accurate, verifiable information, because there's so many times I've seen people say they do their research and they come to a very different conclusion. And so I think research means a lot of different things to people when we say you should do your own research. And so I think this touches back to Dave's question, what can organizations do? You know, even though the coronavirus and COVID-19, our information is changing pretty regularly, we know that we can rely on the Prince George's County Health Department, the Maryland Department of Health, you know, our key hospitals for accurate information. And those are the sources to be amplifying. And when we encourage people to do their research, sending them to those places where we know they can get accurate information. Because I think if they get the message, oh, I'm going to go out and do my quote own research, and they do end up on those YouTube videos, they often go down a pretty unfortunate path in terms of the conclusions they draw from having done their own research.
Excellent point. Thank you for bringing that up. I appreciate that. Mr. DeWitt, any final thoughts?
And Paul, if you're about to end,
Dr. Thomas, hello.
I'm in the Hollywood Squares. I don't know where.
I see you. Yes.
Just very briefly to follow up on Mike and Katrina. Number one, to say they're community health workers certified. Just to get some snaps out there for the community, and so they know. And we provided those shops that are in our network with the very access that Dr. Barr just mentioned. But there was also something about the approach. They don't judge people. They don't shame them. And the pushback I've heard is that for some folks, they feel like when they're encountering some of the health professionals, and I'm looking in the mirror at myself, we want people to roll up their sleeve, right, and get that vaccine. But when you're in the community, Mike and Katrina use an approach of just listening and that plan A, plan B, and then gradually bringing them along. And then in our community town halls, they're talking to people like Dr. Michael Osterholm and Fauci and some of the people in these Hollywood Squares, and they start to have informed decisions. They want to do the right thing. So I'm just glad to see have them as part of this discussion. So thank you.
Well, thank you, Dr. Thomas.
I'd like to raise my hand.
Yes.
Yeah, Paul, good evening, everyone. I have found that modeling is perhaps the best answer that I have used. When they make all the reservations and listen, I've done this. I wouldn't ask you to do something that I haven't done. Well, then they ask the questions, how has it affected you? That experiential modeling has been my best response. And quite often, I'm getting people who say, well, okay, if you've done this and I see that you don't look like you're having any ill effects, I'm going to do it too.
Great. Excellent point. Thank you for sharing that. Any of the other members of the panel like to have a final say? I called on Mr. DeWitt. Mr. DeWitt, anything else you'd like to add? Okay, Sonia?
Mr. DeWitt is trying to unmute himself.
Okay.
Hello, can you hear me?
Yes, sir.
Okay. Well, after listening and gathering, if we had like a little pamphlet, some information from the government, that we would have precise and exact information to give to people. You know, if any pamphlets or something that we could actually carry around or be distributed to the houses throughout the county or throughout the country, at least everybody would have the exact or correct knowledge to approach it with. Yeah, just a suggestion.
But yeah, it's a good suggestion. I think a lot of that information, as has been shared, is available through the health department. I know the Greater Baden puts out information as well. So I think just again to we can never communicate enough is the really the message here. And we appreciate what you're saying here. And we need to continue to focus on that and to get the right information into the hands of the right people. And we will continue to focus on that.
Thanks. Paul, if I can just add one more follow-up on what Mr. DeWitt said. So Donna, have a bunch of links with good, credible information in the chat. And also I'm gonna put the name of a woman, her name is Parveen from Kaiser Permanente. She is looking, and her team is looking to make community partnerships to do exactly what Mr. DeWitt said, make door handle knockers. You know, they don't have a prescripted plan. They want to hear from us what they should be doing. And they said, we don't want to duplicate what anyone else is doing. We want to fill in gaps. So I'm about to put her name in the chat. So anyone who is interested in working with that project, please feel free to reach out to either myself or Ms. Parveen.
Great, thank you, Allison. And Dr. Palakar, any final thoughts?
No, I mean, I think everyone said it exceptionally well. I think this is such an important conversation, and this is really, you know, a community effort. You know, it takes all of us coming together, you know, to tackle this. And I think it's really important, as Dr. Thomas was saying, to understand the perspectives that, you know, people are bringing and the concerns that they have. It's not a universal truth or a universal concern that you know, everyone has. So it's important to have those conversations and, you know, dispel the myths with real information, you know, one person at a time.
Great, terrific. Excellent way to help us end the panel discussion. Appreciate it. Panel members, you've been terrific. Been honored to be working with you here this evening. I think everybody did a terrific job for something that was not rehearsed. We all came through this very well, and as evidenced by the number of people that logged on and posed questions. I mean, it speaks volumes for the interest that folks have and for the action that this healthcare coalition engages in on a daily basis. So thank you. And with that, Allison, I'll turn it back over to you for the final agenda items.
Thank you. So we want to hear from you how the panel went. So please just take a moment to fill out our polling question. We do use information from these polls to help us steer in the right direction. If this panel was useful, let us know. If it was not useful, let us know. And if you have ideas that you would hear about that you would like to topics that you would like future panels about, feel free to put that in the chat. So once again, we just have a 3-question poll here for those on the computer. We want to know if you learned something new at this meeting, if the information discussed was useful, and if you would share information that was discussed with colleagues, friends, or loved ones. So we want to see how we are serving you, so we as a staff can improve our service to you in this coalition. And we'll give about 10 more seconds on the poll. Let us know if you learned something new, if the information was useful, and if you will share this information with colleagues. So we're going to go ahead and close out the poll in 3, 2, 1. And I just have a few updates, a general coalition update to share with you. Just drawing your attention to the chat. There are some good links for good information sources if you want to share these links for folks to do their own research. So just a few other things. So believe it or not, vaccines is not the only thing happening in our coalition. We have a lot of work that's being done. Our behavioral health work group is looking at leveraging work in police reform and re-entry from incarceration to take an in-depth look about how to better support individuals with behavioral health needs who are involved in the justice system. Our health equity group is raising awareness about the root causes of COVID-19 disparities and advocating for a health and all policies approach in the county. A lot of us that work in public health, we kind of see disparities and inequities on a daily basis, but we have a lot of folks now in the health sphere saying, look at what we're seeing in COVID-19. How is this and why is this? We see this in sort of our mainstream news. And our Healthy Eating Active Living work group will be launching a produce voucher pilot program in collaboration with select primary care providers and Giant Foods to help people get more access to fresh fruits and vegetables. So see the latest on our website. We'll drop the link in the chat. That is that's being updated every week or so because we're doing a lot of new initiatives and a lot of work in our coalition. Another update is we would like to launch our social media account later this year. We're getting with the times. We've been virtual. We want to get on social media, and we have a focus on engaging youth and young adults. So these are folks 16 to 24. So we'd like to learn more about what social media platforms you use and what the youth and young adults in your lives use. So we just have another brief poll on social media. So we'd like to know, what social media platforms do you use to read and share community health information? And you can select multiple. We have Facebook, Instagram, LinkedIn, TikTok, Twitter, or another platform. So feel free to join that poll. And then we want to know, how young are you? This is anonymous, so not letting out any secrets, but we're asking this because we do want to engage more youth and young adults. And then our final question is, if you have friends or loved ones ages 16 to 24, children, grandchildren, cousins, etc., to your knowledge, what social media platforms do they use? So we appreciate your feedback. We are a community coalition, so we like to craft our activities to be responsive to the community needs. That's your needs. So tell us in our poll here what social media platforms you use. You can select more than one. How young are you? Because we have an emphasis on engaging our youth and young adults, sort of our next generation of public health workers. And if you have youth and young adults in your world and your life, what are they using? We're going to give a few more seconds. We're going to close it out. And 3, 2, 1. We forgot about Snapchat, but we see that in the post. So we're going to see what folks are using here. So got a lot of folks on Instagram.
Mm-hmm.
We have a good age spread on this call, so that's really neat. And then definitely youth are on Instagram, so excellent. And we're noting these additional platforms in the chat. And then one final announcement I have before we close it out. Paul, our community co-chair, our moderator here, who has served for 2 years, he's going to be retiring from the coalition in June. He'll be stepping down as community co-chair. So if you or someone you know has strong leadership and organizational skills and you're dedicated to improving the health of those in Prince George's County, consider applying for our community co-chair role. Self-nominations and nominations of others are accepted. So Dr. Carter will select the co-chair with input from our current work group co-chairs. And we hope to announce our new co-chair at our next quarterly meeting on June 8th. So if you are interested or you know someone who would be a great fit for this community co-chair role, we have the link to the application. We'll drop that in the chat and also send that out to folks. So Paul, thank you so much for serving our coalition over the past 2 years. It really, truly has been a pleasure. And I still hope, even if you're not co-chair, you hang around a little bit. You're always welcome here.
Well, thank you, Alice. I appreciate that. And I would encourage anyone who has an interest to to step forward and throw your hat in the ring. It was an honor and a privilege for me to serve as co-chair. I think it was the first time we actually had someone from the hospital industry or the hospital perspective serve in that position, and I think it helped to do a lot to bring things together. And the staff, I'll tell you, the staff does a terrific job of supporting you. All I had to do is just show up. So you know, I thank you to the staff for that. And again, I encourage folks to get involved if you would like to serve in that leadership role. And I will end this evening's meeting by saying that it's still important, you know, as was pointed out, like what was the word that people were thinking, and hopeful seemed to be the dominant response. And I too remain hopeful, and participating in a meeting like this continues to make me feel hopeful. But I will also continue to remind folks, we still need to wear our mask, we still need to wash our hands, and we still need to practice social distancing to help us get through this pandemic the way we have been, you know, getting through it up to this point. Those were the three areas, those are the three actions that folks took that made the most impact on us getting to where we are today. And we've done too much work, and there have been too much unfortunate suffering that people have experienced, not to let that go in reverse. I mean, Fauci always says, keep your foot on the gas pedal. So let's keep our foot on the gas pedal of wearing masks, wash our hands, and staying socially distant as we continue to encourage our friends and relatives and members of the community to get their vaccine. And with that, I will move for adjournment, Allison.
Thank you so much. Have a great evening, everybody, and we'll see you again in 3 months.
Great, thank you.